Okay. It's wonderful to be with all of you today out there this afternoon. Happy Thursday, everybody. Um, we'll just kind of hang out here a little bit. I'm with my good friend Jake. I'm sure many of you recognize him by now. My bearded friend Jake. I'm glad to see we got some people hopping on here. We're excited to embark on this journey, and we're excited for the questions that you'll ask us. So in case you hadn't read the title, this is an ask us anything. So you, yes, you, our audience is going to get the chance to drive the conversation. So we'll talk about what you want us to talk about, more or less. So it should be a good time. We have a few questions sent to us in advance, and that we'll get started with that. And we may not get to all of the questions. Our goal is going to be to get to everybody's question, but we'll see how we do. So as everyone's tuning on, I see we got Barbara here already from New Jersey. Excellent. As you're tuning in, go ahead and comment. Let us know you're here, and get thinking of some questions to ask us. So we got a handful of people here already. As I said, it's wonderful for Jake and I to be with you here on this Thursday afternoon. Thanks again for being with us. It's always a good time to connect with you all, and I haven't been on one of these in a while, so I'm excited to get the chance to chat with folks.
Good to have you back on, John. It's good to have you back in front of the people, taking your public opinion bath.
Yes, as Abraham Lincoln liked to say. All right, we got Bill from Great Falls, Virginia. Excellent. Well, as people are coming online and tuning in and all that good stuff, just to reiterate a familiar refrain, we got Patricia from Biglerville, PA. Just to reiterate a familiar refrain, thank you so much, everyone, for tuning in, not just today, but throughout the time all of us have done these videos. All the time we've been doing these videos since the pandemic started. It's been a joy getting to know some of you. And we've gotten a lot of questions from people now that the museum is open again. We're open on weekends, Friday, Saturday, Sunday, and during the week by appointment. Now that we're open, people have been saying, asking us, are you still doing these videos? The answer is yes. If you're here, of course, you know that. But we will still be doing these. So good news for that. And if you've been enjoying these videos, either today or in the past, or hopefully in the future, we'd ask that you maybe consider becoming a member. It really goes a long way to helping us out here at the museum. Consider becoming a member, consider donating if you can. It helps us out. We've been overwhelmed by your generosity over the last several months. And Jake has just posted a link for membership in the comments. That membership is good for an entire year. Gets you free admission to the museum. That'll be good. So if you purchase one today, that'll be good until the end of July 2021. And hopefully between now and then you can come see us, even if you can't. We send you things like our regularly published journal and things like that. So you get all kinds of goodies, even if you can't come be with us in person. And of course, we keep you posted on the goings on at the museum in a way that we don't tell just anybody. So you get all kinds of perks even if you're not local to the area. So we'd ask you consider doing that if you can. And thank you to those of you who have so far. So seeing a number of people tuning in here, go ahead and post your questions in the comments. Today we get to talk about what you want us to talk about. So with that, we had a few questions sent to us in advance. Jake, do you want to take us away with one of the first ones?
Yes. So this one came from Meg on Twitter. She asked, how did medical treatment and conditions for seeking medical help vary between white Union soldiers and black Union soldiers during the Civil War?
Great question. Yes, and I'll jump right in. Great question there. So there's a couple different layers to this question. So one of the things that it is a fact that's well documented, black soldiers suffered from disease at much higher rates than white soldiers. And that is for, and we know that fact, but interpreting why that was the case and what that might mean is part of what we do as historians, and that could be due to a number of different factors. Number one, uh, they may just not have been treated as well, and there's some anecdotal evidence that that is indeed the case. For example, I was just reading up before we came on the live stream here about the life of Alexander Augusta, which I would encourage everybody to do. The first black surgeon in the Union Army, led an incredible life, but one of his first assignments was as part of the 7th United States Colored Troops. Yes, the 7th USCT, and he outranked all of the white surgeons in that unit. And when he was assigned there, they all refused to work because they didn't want to be given orders by a black man. And so there are, anecdotal stories like this where, there is a kind of tenuousness with how this care might be applied to black soldiers. And then the kind of other aspect of this is that a lot of the black soldiers who fight in the Union Army were formerly enslaved people. And as a result, one of the reasons disease spread so quickly through the Union Army, and if you're tuning into the video, you've probably heard us say that 2/3 of all deaths in the Civil War come as a result of disease. Part of the reason disease spread so quickly is there hadn't really been such large gatherings of people, of people in one locale. These army camps turned into basically small cities, and so disease spread very quickly, and it spread very quickly, especially among people from rural areas, because if you lived in a city, you lived in slightly closer quarters than you did in rural areas. So that was part of an issue. And so enslaved people often tended to come from rural areas, but beyond that, their general kind of health and well-being coming from a condition of slavery was already not very good, which made them even more susceptible to disease and things. So there are a couple different layers to the fact, and it is a fact, that black soldiers suffered from disease at a significantly higher rate than white soldiers. Jake, do you want to expand on that at all?
No, I think you did a really good job of describing that. If you want to dive into these kinds of stories about the difference in kind of the handling of African American medical, whether it's wounds, whether it's disease, highly recommend checking out Jim Downs' book, Sick from Freedom. We had Jim on a ways back. It's a fantastic interview. If you want to learn more about these kinds of things, that was a great conversation that we had. You can find that on YouTube or in our back catalog of videos here on Facebook.
Yes, would highly recommend rewatching that, even if you've already seen it. I was literally giddy at the end of that.
Yeah, it was a great conversation, and he is a fantastic historian. Definitely worth checking out his book and the interview that we had with him. John, if you want to take a look, I see we had some great questions coming in online, and we can start to address some of those.
Absolutely, yes. And I want to reiterate for those that weren't here at the beginning, our goal is to get to everybody's question, but it may not happen. And again, if you have a question, throw it in the comments. This is your chance. You get to tell us what to talk about. And I want to touch on this one from Stacy McCarty. Jake, this is very timely for you. Is there any proof of angel's glow from the Shiloh battle? You want to, and she asked like a primary source. I don't know about a primary source, but I do know that it is indeed true. Jake, do you want to talk a bit about that?
Yeah, this is a common conversation, a common question that we get. It is definitely one of the more bizarre medical stories of the American Civil War. I will throw this out that the Battle of Shiloh was not the only battle where this kind of phenomenon was experienced. There are similar reports of so-called angel's glow or strangely glowing wounds from the Battle of Chancellorsville in 1863 as well. Doctors report it there. Our understanding now is that this is a form of bioluminescence, basically a bacteria that in its the stage of its life cycle is going to be giving off some glow. I can't begin to pronounce the name of this bacteria because I did look. I've been doing some research on this for another project, so it's, as John mentioned, it is timely. So again, my Latin is very poor, but it's photor habdus for photo. I'm butchering this. This is amazing Facebook Live content you're getting right now is watching Jake try to butcher.
And if you're if you're listening and you're a Latin professor out there, I'll personally pay for your membership to the museum if you do a Zoom session with Jake about how to how to pronounce Latin words.
Yeah, so what you need to know most importantly is the luminescence part. This is something that we're going to be putting out a blog post on in the near future. Like I said, I'm doing some research on this. I don't have a good primary source to point you to yet, very early in kind of my reading on this, but we'll be updating on this very soon. Very much looking forward to working with John, who is the master of all things on our website, civilwarmed.org, to get that blog post out once the research is complete. So this is one where I'll have to give you a little bit of information, but we'll let you know that down the road we're going to be adding more to the story.
Yes. We got another question sent to us ahead of time by Ryan Quint. About, you hear a lot about Jonathan Letterman, and of course we sing Jonathan Letterman's praises quite a bit here at the museum. Just if you somehow haven't heard us talk about him or you haven't heard of him, just go to our website, civilwarmed.org, and just type in the little search bar Letterman, and you'll find all kinds of good stuff. But yes, who, if anyone, was the equivalent in the Union Army of the Tennessee or Army of the Cumberland? So I did a little bit of digging in advance of this, and there's a slew of different medical directors spread across not just those two Union armies, but of course all over the place. And notably, the very first medical director of the Union Army of the Tennessee, these are the armies that fight out west, west being a sort of relative term in the Civil War. We're talking, Tennessee and Georgia and places like this. The first medical director for the Union Army of the Tennessee was none other than John Brinton. He was under Ulysses S. Grant's command. John Brinton, of course, leaves that post as medical director shortly before the Battle of Shiloh to go become, or before or after, I think it's shortly before, to become in charge of the Army Medical Museum. Which I'm sure you've also probably heard us talk about. He is replaced by Surgeon Charles McDougall, and he's with the Army of the Tennessee for quite some time. And then McDougall is at some point replaced by Surgeon John Moore, who serves for the duration of the war. With the Army of the Cumberland, we're talking about Surgeon Glover Perrin. And then he's replaced by Surgeon George E. Cooper. So there's sort of a rotating cast. And then I also came across a name, Surgeon E. Swift, who is medical director for the Department of the Cumberland, which I suspect is probably maybe over all of that. And that's just kind of for a couple different Union armies. There's, of course, several different departments, including departments in North Carolina, Mississippi, Arkansas, the Shenandoah Valley, West Virginia, including a Surgeon J.V.Z. Blaney, which is just too good of a name not to share. So there's a rotating cast of characters all across the board, including in the Army of the Potomac. We talked quite a bit about Letterman, but he's only the medical director of the Army of the Potomac for, about 2 years or something like that, Jake? Probably not even quite 2 years. But yeah, it just goes to show you don't need to be in charge for all that long to make some lasting changes. And let that be a lesson for all of us, and well, wherever we find ourselves.
All right.
So thank you, Ryan, for that.
Yeah, let's go back to our line of questioning from the comments section. If you do have any questions, this, as John has mentioned numerous times already, this episode of our online content, our video today is about you. So you are all driving this. So if you have any questions, want us to discuss a topic, please present that into the comments section, introduce it down there. We will get to those. I did see one from an old friend of the museum who, now I'm trying to pull up I think you have it there. It's a person with a familiar name to you, John, has a good question for us.
Yes. Wait, are you talking about my dad?
I am talking about your dad.
Yes, he asks, who's your favorite Civil War doctor, soldier, and or politician? A lot of good candidates to choose from. Plenty of terrible ones, I suppose, too. But for the purposes of this question, a lot of good candidates. Do you have one in mind, Jake?
All right, so let's start with doctor. So I'll do my doctor, favorite Civil War doctor first, and then we'll go over to you, and then we'll bounce to the next one, and we'll do each one of those because both of us love Civil War history. We have answers for, we have favorites. Favorite doctor for me of the Civil War, you've already heard his name, and that's Alexander Augusta. He's a fascinating character, one of the African-American surgeons who served in the U.S. Army during the Civil War. The reason I am particularly smitten with him is that he was, during his service, he was very particular about him being recognized as an officer of the United States Army. This was something that was really important to him. He wore the uniform of the U.S. Army. He wore it proudly, and there were a lot of people who hated him for it. He was attacked because of that, wearing that uniform. He was thrown off a streetcar at one point. Because he was wearing his uniform, he was viewed as being out of his place as a black man in America to be in uniform. And Augusta very much viewed that it was his rightful place to be in the Army. He was a medical professional. He deserved to be treated as such, with respect. And he carried that after the war as well. He becomes one of the founding members, founding teachers at Howard University's medical school in 1867 and 1868. So he's a fascinating character. He's buried at Arlington National Cemetery. If you want to learn more about one figure from the Civil War, I highly recommend it be Alexander Augusta.
And why wait? I'm going to post a great article about him in the comments right now.
Perfect. So, John, who is your favorite Civil War doctor?
Mine rotates pretty regularly. Kind of based on who I'm reading about, but I'm going to go with Surgeon Charles Tripler, who I've never really thought too much about, but recently I started reading one of his reports. So he's the very first medical director of the Army of the Potomac. He's a guy that Letterman takes over for. And I always assumed, because things are pretty rough in the Union Army when Letterman takes over, I always assumed that the very first medical director was something of a slouch. But I was reading his report, and things were rough when he takes over after the Battle of First Bull Run, which of course is a disaster for the Union Army. And he makes a lot of positive change, but the fact that it's such a mountain to climb makes his task perhaps near impossible. And so I was reading his report, and he's going on about how among many things that need to be changed, there need to be more strict physical examinations to get soldiers into the ranks, because soldiers are physically incapable of doing their jobs. They have histories of disease. And so he's in this report, he's calling out these examining surgeons as inept, immoral, or negligent. And it's just, he's not pulling any punches. And he goes on to say that basically whoever these surgeons were that just didn't do their job, they've defrauded, that not only have they committed a disservice to the Union Army, they basically defrauded the American public out of $200,000 for the service of all these people. It's astonishing. Just reading these words, you can just feel the righteous anger emanating off him. So I found that report to be a fascinating read. So I'll say Charles Tripler.
That is an interesting, bold choice, John. What's the next category there?
Soldier, and I'll just keep the good times rolling. I'm gonna go with Thomas Hanna, of the 80. This is terrible. I don't remember what regiment he's in. He fights. He's wounded at the Battle of Gettysburg. He's like the 84th, 86th, 82nd New York. Anyway, he's wounded on the first day of fighting, and during my time at undergrad, we were I was assigned him as a group project with some people who I ended up becoming basically lifelong friends with, and we just had such a, I mean, anyone that's done Civil War research or really research of any kind knows that there's some degree of thrill in kind of tracking down little bits of evidence, and we just had it was one of my first occasions in tracking down evidence. And I remember a friend of mine and I, we stumbled across this golden piece of this golden primary source, something that he had written in his own words, which we didn't know existed. And just like the euphoria in discovering that was just so fun. But yeah, he leads a fascinating life. He's wounded at Gettysburg. He recovers, and he goes on to be, I think, a lieutenant in United States Colored Troops Regiment, and he goes on to have a long and healthy life. But yeah, he was such a fun person to research.
Yeah, I have to go with somebody that I stumbled across in research too. I work on another project called Penn Civil War, which is about Pennsylvanian Civil War blog. For those of you who've been here a while and watched these videos, I'm a native Pennsylvanian, a proud Pennsylvanian. In working for that project, I came across the name James A. Beaver, who was that name is familiar to me as a Penn State football fan growing up. Beaver Stadium is where Penn State plays its football, and that is named for James Beaver. So actually, through the lens of that stadium, I wrote this blog post for Penn Civil War about James Beaver, who served with the 45th Pennsylvania and the 148th Pennsylvania. He was wounded numerous times during the war. Fascinating character. Has incredible stories from the war that he wrote about pretty extensively, both during the war and then afterwards. He serves as Pennsylvania governor, serves with the board of trustees for Penn State University, maybe even as the university president at one point. Fascinating character, definitely at this time. And this is something like John, it changes for me. Right now, I would have to say go with James Beaver.
And then finally, politician. And I already know who yours is, Jake.
Oh, I'm curious. Who?
It's obviously James Garfield.
James Garfield is up there, I have to say. One of the more eloquent speakers. But I'm going to go back to my native Pennsylvania and go with good old Governor Andrew Curtin during the Civil War. War governor, keeping Pennsylvania safe, or sometimes not safe, from Confederate invasion. But a fascinating character out of Bellefonte, Pennsylvania. I'm going to have to go with the Pennsylvania governor for my favorite. If you're gonna it's weird to have a favorite politician, but
isn't that such a sad statement? It's like, favorite politician. I'll say I don't really have a good answer. I'll say Henry Wilson, Senator Henry Wilson from Massachusetts, just because, and I think this is such an underexplored topic. Back when I had designs of being a great historian writer, before I realized how just insanely challenging that is. One of my sort of dream research projects, he was in charge of the head of the Senate Committee on Military Affairs or something. And for any commission, for any general to become a general, the Senate Committee on Military Affairs had to approve their commission. And it's just and I'm sure most of the time it was pretty dull work, but I have to imagine there were some meetings where certain nominations were unusually contentious, and they didn't want to promote someone for some reason or other. And I just, that struck me as sort of a fascinating cog in the greater bureaucracy of the federal government during the Civil War. And I wrote a little something on that a while back. But anyway, that whole system always struck me as fascinating, and for a long time my eyes were just sort of trained to look for Henry Wilson's name. So even still today, whenever I read his name, I have a little twitch, oh, got to underline that to come back to later.
All right.
Anyway,
we got we're going to take one from Twitter now. This one comes from @SodiumBall. Interesting name. Asked, did any remains of soldiers end up on the dissection tables of medical schools? This was a This is a really good question. I saw this one and I was like, oh, I'm looking forward to answering this. So we talk quite a bit about medical education at the National Museum of Civil War Medicine. It is important to understand medical care during the Civil War. You need to know what the professionals who were practicing medicine at the time, what they understood, what they were taught in those medical schools. And dissection is something, the study of anatomy is something that becomes increasingly popular as the 19th century goes on. But this was something that was pretty difficult for medical schools to actually get their hands on cadavers in order to allow medical students to operate, to practice, to dissect, to understand the human body. And so they resorted many times to stealing bodies. That becomes very, very problematic. As you can imagine, you don't want grandma having her grave being robbed and her body being dragged to the medical school. That's a bad look for everybody involved. What the Civil War presents is this opportunity, and this is going to be understood as such from the medical professionals, Union, Confederate, both armies recognize the medical opportunity that is coming from the Civil War. And it's fairly callous to think of it this way, but this is the way that they presented it. And that is, you have all of these men who have essentially signed over their bodies to their government for service in the army. And so the medical professionals, the doctors, many of them who have been serving in the military for a long time, they recognize this is a great opportunity that when something goes wrong with these soldiers, should they die of disease, should they be killed on the battlefield, should they be killed in accidents, should they die of any cause, these bodies are now available for study. And I documented this in a blog post previously where a soldier it was a Union soldier, was killed, was executed for desertion in 1861. And the first thing that when the brigade medical team got together after the execution, the first thing they did was take the body, bring it to the medical tent, and begin to do a dissection to look at what a bullet or a series of bullets did to the human body. This is a practice that is going to become super common during the Civil War. There are going to be dissections. There's going to be a desire to take apart the body, dissect the body, to understand what was going on with, whether it's from disease, whether it's what bullets did to the body, what cannonballs did to the body. You see this in a couple of different facets, and I'll get to the main part of your question here in a second, but I do want to bring it up. The United States Army Medical Museum is established in 1862. One of the parts of that museum is one of the missions that it had was to collect medical specimens. This meant amputated limbs. This meant other parts of the body of soldiers who died in service. And in some cases, it's Union and Confederate soldiers. Those pieces of those soldiers are brought back to Washington and are studied. So there you have these bodies being dismantled, in some cases because of amputation, in other cases just for dissection, being brought to the medical museum for study. Then you have situations like what happens in places like Philadelphia during the war. If you wanted to become a medical professional, you wanted to be an elite doctor in America before and during the Civil War era, you went to Philadelphia. And there were numerous military hospitals that were established there, especially after Gettysburg. These are going to become really important. There's going to be thousands of patients. Because there's all these medical students there, many of their professors are doctors working in those hospitals, whether on a contract basis or whether actually working with the U.S. Army. These medical students now have access to these hospitals, and they're going to be brought in a variety of fashions, in some cases as cadets, in some cases just as volunteers, in other cases as students being brought in to see what rounds are like. This is a tremendous opportunity for these medical students to come, and they would be able to see things like dissections being done by their professors in these hospitals. So it's not necessarily that the bodies were brought back to medical schools. Oftentimes these kinds of procedures, post-death procedures in terms of figuring out what killed this patient are going to be done in the hospitals, and then in some cases the medical students would be there. So this is an opportunity for medical students to learn more about their soon-to-be profession that is created by the Civil War. And afterwards, dissection and the use of cadavers in medical schools, in part because of how terrible the Civil War was and how much death and suffering, it changes the view of death. And there's an understanding that no one should, if someone dies, they have medical value to the rest of the community, and their bodies can be studied to allow us to really progress medicine forward. So science really advances as a result of the war. And science advances because of things like, medical students having access to these kind of opportunities.
Mm. Yeah, so the soldiers' remains don't go to the medical schools. The medical schools go to the soldiers' remains, basically. Um, Popping over the comments, Barbara asked a question, our very first submitted question in the comments. Were poison, ivy, oak, sumac problems with sleeping, fighting, living in the fields and woods? How common were they? How are they treated? Um, well, they weren't cataloged in the medical and surgical history, but you have to imagine that it happened with some degree of regularity. And I'd actually be curious if the book that first comes to mind with questions like that would be Katie Shively's Nature's Civil War. I wonder if there's something in there about that. But, you have to imagine that's something that came up pretty regularly. And it's probably something that the soldiers would probably treat themselves once they kind of figured out what it was. I mean, these people aren't dumb. They have something that itches and they remembered, going through a certain patch of field or whatever. I mean, I'm sure they would kind of put that together, which gets to ways that soldiers themselves administered their own health care, which isn't something we talk about very much. And I would imagine, I'm not sure, but I would imagine that would be how they would take care of that. Let's see here. Continuing to go through the comments here. This is, we get asked about this a lot. And Jake, you can speak to this probably more than I can. Bill asks, was the TV show Mercy Street historically accurate? And given that there were 2 seasons and many episodes, that's a big question. But you were working at the museum when that was happening, so I'll let you take that one, Jake.
Yeah, this is a great question. One that we do get fairly often, thankfully.
And we were involved with that.
Yes, yeah, we were. The museum was involved in the first season as historical consultants, and members of our board of directors were involved in the second season. So historical accuracy is complicated when it comes to Mercy Street. When it comes to medical scenes, by and large, Mercy Street does a better job than any other major television or film production of Civil War. It is better medical depiction than any other production, by far. They focused on the accuracy. They wanted to make sure that the procedures were accurate. If you watch, I believe it's in episode 3 or 4 of the first season where we see one of the main characters amputate a leg, and it is, I mean, they nailed it. They showed how it worked. They showed that there was anesthesia involved, which I'm always like, woo! Get the historical accuracy there is really important. 95% of surgeries done during the war were done under anesthesia. The second season went into more, I would say, some more radical sides of Civil War medicine. This is things like you see a blood transfusion performed, some other more kind of radical medical treatments that were experimented with during the Civil War, but were not widely used. Those created lots of conversations that I was really excited about, because people were like, there's no way they were doing this during the Civil War. And it's like, well, we know from the medical and surgical history that there are at least 2 documented cases of attempted blood transfusions during the Civil War, including one that occurred in Alexandria, where Mercy Street was set. So those things, they were very focused on making sure that they got the medical stuff right, which we appreciate. We are a medical museum. We love that. It was great ways to converse and begin a conversation about Civil War medicine that was not rusty saws and biting bullets, etc., which is oftentimes what we get. So put that aside, the rest of the show was a train wreck. There was lots of, the story really suffered. The historical accuracy really suffered. They're trying to include too much. We get a weird John Wilkes Booth thing. There's a bomb plot, which is a true story, but taken to extremes. Second season is also riddled with these kinds of inaccuracies. But the one thing that is most galling to me, and I understand this is not necessarily the producer's fault, they sort of ran out of money as the second season was being made, and in part it's because the way the third season never came out, even though they were trying to get one. And that is, we never saw a true mass casualty incident in Mercy Street. And I understand it's expensive to shoot, but that's really a big major facet of Civil War medicine, is what you do in a situation where it is complete and utter chaos. And the show is set in a hospital that experienced one of those in end of August, early September of 1862, with the Second Battle of Bull Run occurred just less than a few dozen miles away at Manassas. Alexandria got 10,000 patients in the span of a few days. Mansion House Hospital took in a huge number of those patients. They were completely overwhelmed. Their staff they have patients coming out of the windows practically of this former hotel. And you never see that in the show. And they skip right over Second Bull Run and go right to Antietam. And I, it was a hard one where I was like, oh, we went through a whole medical drama, where we never saw one of these mass casualty incidents, which is always what these shows kind of address. I was thinking actually of this right now. I think I've watched one episode of Grey's Anatomy, and it was an episode where there was a huge influx of patients in an emergency situation, and they have so many patients that they have to figure out who they're going to treat. So, it's just, it's hit or miss with Mercy Street, in my view. And again, this is my opinion. Others in the comments might disagree with me, but that's the way that I see it, kind of from I don't want to say my insider's view from the museum, but from our perspective at the museum.
Yeah, and thank you for that, Jake. A follow-up to the conversation about poison ivy, Dan Casella chimed in the comments here. Jewelweed is a natural solution to poison ivy and usually grows right near it. Learned that at an Antietam event when I had poison ivy all over my hand. Took it away in like 35 minutes. So, again, soldiers practicing sort of self-administering healthcare, you would imagine that that they might have keyed onto that. So thanks for that, Dan.
And living historians now continuing the legacy of handing off self-care methods in the field, just like the Civil War forebears would. I love that.
Mm-hmm. Let's see, going to a question we got from Twitter, which will then lead into a question we got from the comments. What, if any, role did Civil War doctors play in the Franco-Prussian War? Submitted by @Susan02147.
All right, this is another one of those great questions that I saw from Twitter, and I really appreciate. This is a great question, Susan, if you're watching. Hope this is going to answer your question. In a way it will, in a way it won't. I don't know of any doctors specifically. That doesn't mean that there aren't any. Chances are probably pretty good. There are a handful of either American doctors or there are European immigrants who were here in the United States and treating soldiers during the Civil War that went back to Europe and participated in the conflict. The way that I'm going to choose to answer the question is more of an idea. And one of the really crazy things about when you start looking at Dr. Jonathan Letterman and his influence during the Civil War and in his legacy afterwards is that Letterman created this system in the Army of the Potomac that then gets adopted by the U.S. Army of creating an organized ambulance system, structuring an evacuation system that is going to care for a soldier from the moment they're wounded on the battlefield all the way back through rehabilitation in general hospitals that have been established. This system worked during the war, and it is going to adapt as the war changes and becomes less about these field armies maneuvering and more about, digging in trenches. It's going to change the way the war is going to be fought. This evolution of this system is going to be studied by the Prussians, by the Germans. They're going to send advisors who are going to watch this. They're going to send experts from their own military medical departments, bring them over to the United States to both examine the way the U.S. medical department is operating during the war, and then also to go to the Army Medical Museum and study the aftermath, to look at the reports, to go through the data, to understand the way the United States was conducting the war from a medical perspective. And the Prussians hone in on Letterman's system. They realize that it is going to work for them. They're very organized. They want a system in place to care for their wounded. And so they're going to take that system back, what we call the Letterman Plan. They're going to call the American Plan, and they're going to institute what Letterman put in place on the battlefields of the American Civil War into the Prussian army. And this is an important time in Prussian and German history as wars of German unification are going on, and ultimately a unified Germany is going to develop in the aftermath of these conflicts. And so Germans, Prussians are going to go to war with France in 1870, as you brought up in your question. And that Prussian army that is going to go and fight in France and defeat the French, utterly rout them, has that Letterman system with them. So they don't have Letterman himself. They don't have an American surgeon in charge of things, but they're using a system developed in the United States during the Civil War, and they're using it on the battlefields of Europe, and they're using it very, very successfully. They honed the system and adapted it for their own purposes on the battlefields of continental Europe, which is pretty cool. Now, to take this to the next level, I will say that we have a connection through the museum to a figure, American woman, who becomes part of the medical situation in the Franco-Prussian War, and that's Clara Barton.
It's worth noting that this innovation is not one way. Of course, the Letterman plan gets instituted and innovated via the Franco-Prussian War, but some practices that happened in that war come back to us via Clara Barton. Didn't mean to interrupt you, Jake. I just want to point out that the kind of two-way cross-pollinization there.
Yeah, it's like a reverse. It's kind of the reverse of the situation with Florence Nightingale in the Crimean War. She plays a role in developing hospitals and changing the way patients are cared for. And those innovations are used by American medical practitioners during the Civil War. And in fact, Clara Barton was called the American Florence Nightingale, which Clara Barton was not appreciative of being called.
I'm sure she didn't like that.
She was Clara Barton, the angel of the battlefield, John. She was not the American Florence Nightingale. She is her own woman with her own identity. But Barton goes to, after the Civil War and after the Missing Soldiers Office, where Clara Barton spearheads the efforts to find missing soldiers, she will travel on a vacation to Europe. But because she's Clara Barton, she's going to get caught up in the middle of a major war on the European continent in the Franco-Prussian War. And she was in Switzerland and learned about the International Committee of the Red Cross, was really impressed by them, and then went to war with them. And so she got to see the International Red Cross at work up close as a volunteer, and she was so impressed by what the nurses of that organization were doing and the relief work they were doing that she decided that the United States needed to be part of this. And so she brings that back to the United States and becomes the founder and first president of the American chapter of the Red Cross. So you do see this situation where there is, as John mentioned, this kind of pollinization of, America influencing Europe, Europe influencing America, and there are some of these figures that are going to play a role in that. I will say your question has inspired me to go and find out if there are any Civil War doctors who do play a role during the Franco-Prussian War who are actually there. That's a really great question, and again, shows that this influence of one conflict bleeds over into the next.
Mm-hmm. And I'm going to tie this question and us talking about Clara Barton and the Red Cross to a question from Patricia Hawthorne in the comments here. She says, I've seen a picture labeled Civil War nurses with a Red Cross on their uniforms. Is this correct? Was the Red Cross symbol used during the Civil War? I'm fairly certain the answer is no. And if it was, not in a capital RC Red Cross way. If it was used at all, which I don't believe it was, it would have been just purely serendipitous, like, this is just a red symbol that we can use.
Yeah.
And it's also probably worth noting there were Union Corps badges that, there was a Union Corps badge that resembled that, but it's unlikely that nurses would have been wearing it. So it's not, completely implausible, but it's highly, 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 highly unlikely. Let's see here. Going further down into the comments here. Yes, more of a personal question from my dear mom. When did both of you know you wanted to become historians?
Oof. John, what do you got?
I was a real nerd, pretty much from when I was very, very small. I was always sort of fascinated by Civil War history, and I'm not even sure I could totally say exactly why, but yeah, from a very young age, I was always interested in this. And as evidence for this, of course, I had lots of toy soldiers as a kid and things like that. And I was, very into the movie Gettysburg as a kid, which I now realize is, it's sort of a flawed film. I love it just as much for its comedic value these days as its historical value. But and as an only child, one of the ways I would sort of entertain myself, I had a toy musket like any good young Civil War aficionado, and I'd be on one side of the living room and I'd fire the gun and I'd run to the other side of the living room and then get shot. So I've been into this from a very young age, and despite many people, not in my family, I had a very supportive family, but many people have been like, "Oh, are you sure you want to study history, John?" Um, I managed to continue going through and was fortunate enough to find a job at the museum, which I never expected to study medical history, but I love studying medical history, and I did not expect to enjoy it as much as I do. So just goes to show, you might think you know what you want to do, but sometimes you don't quite know what you want to do.
Yeah, I found a similar medical passion or passion for medical history while working at the museum, starting out when I was in college in Frederick at Hood College, small liberal arts school in Frederick. Going back to roots, my first love was World War II history. I had a great grandfather that participated in World War II, was in the Merchant Marine. So shout out to the movie Greyhound that is out there now for showing the terrible situations facing the Merchant Marines during the Second World War. But then he joined the Air Corps, the Army Air Force in 1942 or 1943. And I learned his story and got interested in seeing movies and TV shows, got interested in World War II and started reading books. Fairly early on, shortly after the National Civil War Museum opened in Harrisburg. Harrisburg was about 45 minutes from where I grew up. Went there and was decidedly not interested in the Civil War. Saw the movie Gettysburg.
No offense, Wayne Motts, if you're watching.
Yeah, no, I've been to the museum and love working with the folks at the museum, and they do a great job there in Harrisburg and keeping Civil War history alive in central Pennsylvania. Very appreciative of that. I watched Gettysburg, Gods and Generals, neither
Gods
film.
and Generals. Oh no.
But Gettysburg, it didn't do it for me, still doesn't do it for me now. It doesn't have that same nostalgic feeling for me because I wasn't as interested in it. But I was actually just talking about this today. One of the turning points for me was I was an editorial fellow at a new newspaper my senior year of high school in Harrisburg, the Patriot News. And I got into listening to NPR and listening to Fresh Air with Terry Gross, who is by far one of the world's best interviewers. I listen to her interviews as we are trying to do interviews for the museum and try to emulate a little bit of what she does very poorly. Have a long way to go. We all have a long way to go before we're to that level. But she interviewed a professor of history that had a book out in 2011. It was Adam Goodhart, and it was 1861 Civil War Awakening. And I listened to this interview, and I was just blown away. I was blown away by how he made the conflict much more alive to me than it had ever been. To me, Civil War history growing up so close to Gettysburg was like reenactors and living historians and ghost tours and all of these things that were, I mean, I don't want to
there's not necessarily anything wrong with any of those things, but it didn't connect with you.
Yeah, it was much more like history carnival as opposed to like something that was real and tangible to me. And he made it real and tangible to me in a way that Gettysburg hadn't to that point. And from that point, I was like, oh, like I really am interested in the war and the Civil War. And, got to college and started out as a journalism major and ended up getting into history kind of professor saying, hey, you like history, you should do both communications, journalism and history. And that kind of started me on the path and volunteered, interned, and found a job at the museum. And here we are. I never thought I would be doing what I'm doing today, working at a museum, working in Civil War medical history, but I love this journey. It's been fun. I've learned so much, and I'm learning more every day. And so I appreciate these questions. It inspires us to look into new quarters, new areas that we haven't yet explored, and
Absolutely.
allows us to learn some new information. We're learning every day. That's one of the great things about working in this field is you literally can't know it all. There's so much information out there, and these kind of conversations and allowing us to, you guys asking us questions and throwing them at us. It's a great way for us to, as historians, to learn more and look into new stories.
Absolutely. Uh, Great question via Facebook in advance from Dan Casella. What were the logistics and process in getting a wounded soldier off the battlefield to a hospital? How did that all break down? The real nuts and bolts of that. So soldiers wounded on battlefield A. Um, well, right off the bat, there's sort of a couple different ways this can go. It depends on where he's wounded. If he's able to walk, um, he'll probably know, well, he certainly won't be heading towards the firing, and likely will start moving towards the rear if possible. And ideally, we'll come across a field dressing station, which is the first part of the Letterman plan, assuming that's been instituted at the time, whatever this battle is happening. But in pretty much in both armies, mostly throughout the entire Civil War, there's some sort of medical presence on the battlefield. And so if the soldier can walk, it's incumbent on them to go find that. But if they're shot in the legs or something like that, either comrades may take them back, stretcher bearers if they're available, and that's sort of a chronic problem throughout the Civil War. There's never quite enough stretcher bearers. And so if stretcher bearers are available, when the shooting starts to die down, ambulances of the ambulance corps will actually go out onto the battlefield to get these soldiers. So there's a number of variables right from the moment the soldier is injured. And then, of course, once they're within the hands of surgeons, and this is something that gets sort of an innovation from the Civil War that carries on throughout today, triage gets practiced. How serious is this injury? Do they need to be treated right away? Of course, they'll stop the bleeding if there's any, particular bleeding and things like that. And then they would be sent via wagon to wherever the closest field hospital would be. And it's there at the field hospital, typically not on the field, where stabilizing procedures are done. We're talking amputations or any other sort of surgery that might be necessary. And then from there, when they're able to be moved either via wagon or often and preferably by train, it'd be taken to larger cities where you have general hospitals, purpose-built facilities, because field hospitals, anything on the field is improvised. Nothing where soldiers are treated within a few miles of a battlefield is purpose-built to be a hospital. And so their final destination is a purpose-built hospital. Anything to add, Jake?
Yeah, I'll just add that this oftentimes for the soldier themselves, it's a very unpleasant situation, an unpleasant experience, as you can imagine. Being shot in the arm or the leg by a mini ball, was a very unpleasant experience. The aftermath of these medical procedures was often also very unpleasant. They're not washing their hands. These wounds all become very infected. They become very painful. Infection's a very dangerous threat after any of these surgeries or serious medical operations. So you have to deal with that pain in addition to, the actual wound itself. So the transportation for a lot of these patients, at least initially in their care, unless a battle took place on a rail line, which is far from the norm. It does happen during the war, but is not always expected or near a major waterway where steamships can get to. So the transport of a wounded soldier initially is going to be on horse and wagon. And you better hope that you got one of those designed ambulances, the ones with the suspension system, because otherwise, if you're carried on a regular Army ambulance, it is going to be a bouncy, terrible ride for you. So these experiences in transporting these patients was often very uncomfortable. And the Army was aware of that. And so there's going to be the establishment, when possible, of semi-permanent field hospitals that will be established after, say Antietam. There's going to be a hospital that's going to be established there for patients who are not stable enough to be moved. They understood that moving a patient is pretty dangerous at this point. And so when possible, they want to treat them in place. And that wasn't always possible, obviously. But you asked in the question, about the experience of one of these soldiers being transported, especially long distances that you specifically mentioned, from Gettysburg to Philadelphia, say a member of the Iron Brigade, and going home to Wisconsin or Indiana or Michigan. That was extremely unpleasant. And they would have held the patient in Philadelphia until they were pretty sure that they would be able to stand up to that journey back, because 19th century rail transport, while smoother than horse-drawn ambulances, was not all that smooth, and also presented its own risks. But I hope that gets to, to your question, Dan. It was a really good one, and get to hopefully everyone else here, enlighten them a little bit about the experience of a wounded soldier.
Dan actually has an immediate follow-up here in the comments. He said, my question meant more of after initial battlefield hospitals to national hospitals like Philly, DC, and then back to their home state. So I would think a lot of rail transport, especially going back to their home state.
Yeah. Then and most often it is going to be these soldiers. So the way that the rail transport worked for say wounded soldiers, or really for any soldier at this time, these rail journeys, say, get from Philadelphia to, rural Wisconsin in these days, it took a long time. And so the Army or organizations like the Sanitary Commission would often have what are called soldiers' rests in a lot of these spots, especially the kind of key rail hubs. So there was one in Philadelphia. I believe there's one in Pittsburgh as well. And there would be all along the rail link heading west out of Pennsylvania through Ohio, Indiana, Illinois, or up into Michigan. And those were places where soldiers could have a place to sleep, a bite to eat, a hot meal, supplied either by the government or by these institutions, organizations like the Sanitary Commission or local relief organizations, to give some comfort to these soldiers. And many of these organizations do have doctors as part of that, so they might be able to tend to any, say if something reopens. And many of these places also have military hospitals. So if a patient needed to be readmitted in a place like Pittsburgh or further west, Columbus, Ohio, other locations, there were oftentimes medical personnel, civilian, but there in some cases were also military medical personnel and facilities that had been established during the course of the war to treat them. So an unpleasant, I would say, even after recovery, unpleasant journey, getting jostled around on trains going over the Allegheny Mountains heading west. But there were steps taken to try to give these soldiers some measure of comfort on their journey.
I actually didn't know that bit about that, or that function of the soldiers' rests. That's cool. Tom Frezza has a great question that I think we're all wondering about. He asked, Jake, when are you going to shave your beard into the Burnsides look? Do we have a timetable on that?
No, but this is probably the last live stream with the beard in its current form. It's getting a little full. Yeah, no, I'm not going to go with the Burnside look. I don't think that it would be appreciated. I don't think it would be appreciated.
It would. I'll stop you right there. It would be appreciated by me.
Yeah, and probably by Tom and Dan. I think I saw he seconded that. So.
Yes.
No, I don't think I'm going with the Burnside mutton chops anytime soon.
Well, you have to at least do it and take a picture just so that exists.
Yeah, maybe we'll see. Yeah, that one might be a little too much for me. I do want to. I think I'm trying to remember who's the general with like the sideburns that are like super like straight out pointy. Is that George Crook?
Yes.
That's more my speed.
The Confederate Surgeon General as well. Moore.
Yeah, Daniel Preston Moore. Yeah, he has that too. Yeah, maybe. I don't know. Maybe I'll just go. I know Tom is a big fan of the mustache. Maybe I'll just leave a mustache there for a little bit. Probably.
Hey, we'll get you to do something. So we're coming down to the end of our time here. We're not done yet. We're gonna get to a couple more, but I would just want to reiterate before we wrap up. Thank you again for tuning in. And if you've enjoyed the program, if you have been enjoying all of our live streams and other videos, please consider supporting the museum. Especially these days, it helps us out so much. Consider becoming a member, and if you have become a member, maybe consider donating, or at the very least, liking the video and maybe giving us a share. All of that helps us out quite a bit. So if you'd be so kind, it'd mean the world to us. So I'm going to close with two questions, one from Tracy and then another from Dan. Tracy asked about were there ever instances on the battlefields during which the soldiers treated members of the opposite side, what she refers to as quote unquote crossing the Mason-Dixon line, which I haven't heard it put that way, but yes, she asks about that. The short answer is yes.
Yeah, do you want to take first swing at that, John?
Yeah, so it did happen. The tough thing is it's hard to know exactly what that looked like in practice, sort of in real time. So we have a number of surgeons who write about, Union surgeons or Confederate surgeons with members, soldiers from the opposite side in their hospital and, treating them. So, I mean, we know that it did happen, and it almost certainly happened on the battlefield as well. At the end of the day, these are doctors. Their goal is to help people get better, and they're not just going to watch someone bleed out, standing next to them. Now, what did that look like in practice, in real time on the battlefield? That's a little bit harder to pin down. Oftentimes these units were raised all from the same town. And typically, if you're not best friends with everyone in your regiment, you're at least oftentimes familiar with people in your regiment. And I wouldn't necessarily expect anyone who, if they were faced with two people, someone they knew that was, and someone they didn't know with equal severity of injuries, my guess would be they would treat those that they knew first. And so if, say, a Confederate surgeon was faced with a Confederate soldier and a Union soldier, both who have been wounded, I would have to imagine they would treat the Confederate soldier first, and same vice versa. That's just my gut. Now, we don't have as much sourcing on that as it played out in real time on the battlefield. Now, the other wrinkle, of course, to throw into this is Confederate surgeons treating African-American soldiers. And there's not a whole lot of sourcing on that either, but we have a great post on our blog by Kyle Dalton about medical evacuation and African-American soldiers. And there's some anecdotal evidence where there are white officers saying that they would prioritize removing African-American wounded first, knowing that they may not be treated by Confederate surgeons. And that's just one isolated source. It's hard to know, again, how widespread all this was, but that's the other angle here that is worth mentioning.
Yeah, it's definitely, this has been an evolving kind of study for the museum. One of our taglines is divided by conflict, united by compassion. And that is, overall, it's pretty true. But when you start getting into the weeds and you start looking at these individual stories, that narrative starts to fall apart a bit.
Yeah, I like the way that you put it, Jake. It's pretty true, but it's not absolutely true.
Yeah, these are competing armies. Their job is to kill the enemy. And at this point in this war, the enemy was their fellow countrymen, their fellow American. And this, there are a lot of these stories of, these soldiers and the surgeons, their job, their main job, what they were trying to do was to defeat the enemy and to win the battle, win the war. And that meant killing their fellow countrymen. And that leads to a lot of hostility, a lot of of anger, and it needs to be important to think of it in that context. Now, with that being the backdrop for this, it's astounding the stories we do hear of merciful action that, you know, between the lines or after battle moves on and the wounded are left behind, the stories of soldiers caring for each other and you know, regardless of uniform, you'll hear of Billy Yank helping Johnny Reb or vice versa in places like Gettysburg. And that undeniably happened countless times during the war. And surgeons, you know, the medical personnel very much held themselves in many cases to this standard of ethics, of caring for this other person, you know, regardless of the color of their uniform, who they're fighting for. Those ethics did not always, and this is Northern and Southern, this is Union, Confederate, those ethics did not always carry over to men of different race, did not always carry over to black men in uniform. And that is an aspersion on Union surgeons, on United States surgeons. There's a question about medical care given to black soldiers was not always of the same quality as given to white Union soldiers. And the same is going to go for especially for Confederate surgeons. So it's a murky, messy, complicated topic to talk about. And I've found that's when we tend to shut down. When things get messy and our nice, neat narratives go away, when you start to realize how much of a gray area something like this question gets to, because it really depends on the people involved, the circumstances involved, what is going on in the world around these people dictates how they're going to behave when it comes to these situations where they're given a lot of choice. They're given a lot of free will in some of these cases. Do you help that man whose arm has been shot off? Do you go and get this man who is disabled, shot in the gut? Do you get him a drink of water? Like, these are decisions that were very much made on the fly, very much made in the heat of action. And again, it makes it hard to really get a hold on what was happening. I know this is a really long answer, but it's complicated. And this is why we do what we do. We want to get in the weeds. We want to learn more. We want to complicate things as much as we are making the narratives nice and easy and neat, and for all of us to understand, because warfare, like all of life, is complicated, and even more so because of the things like the fog of war. So, you know, again, I think I made it more messy and complicated myself here with this answer that I've been rambling on for. But, you know, I hope that it gets you to thinking about this.
There's certainly a lot to think about, no question. And so we'll close today with another question from Dan, pretty open-ended, so we can take it wherever we want. Book recommendations? Question mark.
John, what you got?
Oh, there's lots of fantastic books out there. Well, as ever, I would always recommend Jim Downs' book, Sick from Freedom. It's just such a fantastic book. Can't recommend that enough. Let me see, a little bit more off color though, and kind of grisly, but one that I think is fascinating for thinking about the 19th century and particularly the Civil War, and how Americans and especially doctors thought about death and dissection. It's by Michael Sapple, A Traffic of Dead Bodies. It's all about medical dissection in the 19th century. Off color, a little dark, but it's one that it's a book we don't reference a whole lot, but one that I've read and I found absolutely riveting. So those are two that I would shout out.
All right, and I will go with, on topic for this evening, I will go with Shauna Devine's excellent book, Learning from the Wounded. I have to say, of all of the books that I've read for the museum about Civil War medicine, this remains, after years, my favorite. The book covers how the United States Army became a driving force pushing scientific evidence-based medicine during the Civil War time period. And it is an incredible book. Dr. Devine is an incredible historian doing amazing work in the field of Civil War medicine. She's up in Canada, which is where she lives, where she teaches. does an amazing job. And oh, by the way, she's also on the board of the National Museum of Civil War Medicine. So she has done a lot for the museum. She has really been an amazing resource for us, the staff, the museum as well. And her book is a great resource for all of you out there. If you're looking for a good book on this topic, on many of the things we talked about today, highly recommend picking up Learning from the Wounded by Dr. Shauna Devine. That would be my recommendation.
Good one. Well, thank you so much, everyone, for tuning in and watching and submitting questions. Even if you didn't submit a question, thanks for watching. Please give the video a like, give it a share, give it a heart maybe if you loved it. Thank you so much for watching. Really appreciate it. And again, if you haven't become a member of the museum, maybe consider doing so. It's good for an entire year, so you got a whole year to make it here to Frederick to visit the museum. And in addition, we send you all kinds of interesting things from time to time, like our semi-annual journal that comes out where you get to hear about all kinds of interesting things, both in the museum and the scholarship that we're working on. So consider becoming a member if you haven't. It means the world to us. And if you're already a member, thank you. And just, yes, thank you to all. This has been great fun.
I'll just jump in before we go and say, if you are considering becoming a member, in addition to all the cool stuff you get, you get to know that you're directly supporting these videos. So we are able to do this. We are able to upgrade our technology. We are able to improve what we're doing. And we're putting out a podcast now. We're doing some other digital projects. Becoming a member directly supports that. So even if you can't come to the museum, even if you can't pay admission, you can think of becoming a member as a way of supporting us. So you get free access to the museum when you come, but you're also helping us to create this programming. You're helping us to generate these videos, the podcasts that we are putting out, which, by the way, the trailer is on iTunes and Spotify and Stitcher if you want to go listen to our 2-minute trailer teaser for what we're going to be doing on the podcast. Please, if you can, consider becoming a member, and you'll be supporting these projects, and you'll be supporting the National Museum of Civil War Medicine.
So this has been great fun. I will see you next time, all of you. I'll see you this upcoming Monday, August 3rd. We'll be with one of our longtime docents, Dr. Bob Slauson, who is just a delight. And he's going to be talking about the Veteran Reserve Corps, something in which 60,000 soldiers actually served. I didn't know that. I just learned that, Jake. So a large portion of the Union Army, we're going to be talking about that. So tune in. That's Monday at 4 o'clock Eastern time, same time as this one. So hope to see you then, and thanks so much for tuning in as always. Jake and John signing off.